Dr. Nafsi is here tonight to shine a light on lung cancer during Lung Cancer Awareness Month. Thanks so much for coming in.
Thank you for inviting me.
So let's start with how common lung cancer actually is.
Well, in the United States, the data is that at least each year there are 100,000 new cases.
Oh, wow.
And people, at least 250,000 people are living with lung cancer each year in the United States alone. Yes.
So in order to obviously be treated and to see how you can be helped, you have to know that you have it. So how do we get there? How do we get screened? How do we get,
So
knowledge?
lung cancer, unlike any other cancer, doesn't have many symptoms. And
Sure.
that's the key feature here. So people who are smokers, people who are, in high-risk environments, who work with asbestos, who work with radon, who work in, any kind of plants, nuclear plants, are high-risk people. The general recommendations are that anybody between the age of 50 and 80, whether you're a man or a woman, and you've smoked for at least 20 years of your life, you should speak to your doctor about lung cancer screening. Because screening is a CAT scan that you can do, like a CT scan of your chest, that you can have once a year, every year, between the age of 50 and 80. It's almost like having your mammograms done or your colonoscopies done. So mammogram recommendations are there, colonoscopy recommendations are there, lung cancer screening recommendations are there as well. So one scan a year, once a year, low dose CT between the ages of 50 and 80, man or woman with a smoking history is all you need.
And like most cancers, when we hear it, the earlier you can catch something, the better chances you have to, survive the cancer. So how can lung cancer be treated if we catch it early?
So the key feature here is, like you mentioned, any cancer, if detected early, can save life, right? So with a lung cancer screening scan, you can detect when it's very, very small, when it's not even causing any problem. Most people do not have problems with lung cancer unless it's like almost the size of a lime or larger than an olive, perhaps. So if detected early, it can be actually removed surgically. So it depends on the staging. So if a person gets a scan once a year, every year, if this tumor is less than 2 centimeters in size and there's no lymph node involvement in the major areas of your body, you can actually have it surgically removed. And that's what, as doctors, we are trying to educate people about.
Sure.
If it is in the lymph nodes, then it depends on what lymph nodes are involved. If they are very close to your chest wall, close to your lung, they can still be surgically removed. If they are around that area, then they cannot be removed surgically, but then doctors can weigh in whether you need chemo and radiation first before they can remove it surgically, or whether it's just chemo and radiation along with immune therapy.
Which is why we want to get those screens every year, right? Because
Exactly.
something super small, if you only had one screen, might not be as noticeable, I guess, that if every year if something changes, then that's where your doctor can check it out really early.
Absolutely right. So the key feature is, where's the spot, how small it is it changing or not, is it involving any other areas of your body or not.
Sure.
So the scan really tells us. So even if, let's say, somebody gets a scan, let's say I'm a smoker and I get a scan done, and it's a 5 millimeter spot, and the doctor might say, oh, it's nothing, right? Great. But then you get a scan again next year. If it's growing, you take it out. You don't question it. You don't argue, is it cancer, is it something else? Because what grows is always cancer.
Okay. Now, the best thing would be to prevent this from happening, right?
That's right.
So what is the best thing we can do to prevent lung cancer?
Well, without a doubt, smoking is the #1 cause of lung cancer. So yes, people who are smokers, I highly recommend that they should stop smoking, because no matter what you say, no matter how you do, to prevention lung cancer, smoking is the one thing that you can actually stop doing, for sure.
And if you do smoke and then you stop smoking, how, that can greatly affect, even if you think, oh, I smoked for 10 years, what's the point?
No, the risk still goes down. There is enough studies to show that even if you stop smoking after 10 years of smoking, the risk of lung cancer eventually will go down. But more importantly, I always tell my patients, as a physician, I'm obviously a pulmonologist, but I'm also internal medicine board certified. So I always say that look at the other options as well. The risk of heart disease is quite significant. It is the #1 killer in general outside of cancer world. So if you stop smoking, the risk of heart disease goes down dramatically within the first year, and almost goes down to zero, like a non-smoker person's within 3 years.
Yeah.
So if you're not doing it for your lungs, do it for your heart.
Okay, yeah, do it for all of you.
Yeah, exactly.
Where can we go to get some more information on this topic, or where can we reach out to you?
So, well, I have a clinic here in Rockford, and obviously I offer a lung cancer screening program from my clinic as well. Any person who's a smoker between the ages of 50 and 80, or even if they have a family history or they are working in a high-risk environment, they can come and see me, or they can go and talk to their primary care doctors, whichever works for them.
Okay.
But the lung screening scan is actually very, very cheap, and people who have no insurance, or people who have really bad insurance or very high deductible plans, they can get screened for almost like $125, which is nothing. I mean, it's less than 30 cents a day, you know. So the question I always tell my patients is, you're buying a pack of cigarettes for like $8.
Yeah, right.
Right? Would you spend 35 cents a day to get a screening once a year no questions asked. Just come see your doctor, get a screening done, go get the CAT scans done. There are multiple institutions in the area that can provide lung cancer screening for very cheap price.
All right, well, we can reach out to you at Rockford Pulmonary Clinic. Thank you so much, Dr. Noxie. It was nice to meet you. Coming up next, we're off to Prime Italian Steakhouse to see if their Cajun fettuccine is the state line's best pasta, and then we're making Play It Cool cocktails on Spirit Day. We'll be right back.